What cognitive assessments detect very early dementia? Imagine catching a small sign of trouble before it turns into something more serious. That's what early detection of dementia is all about. When it comes to spotting very early dementia, healthcare professionals use special tests that can pick up tiny changes in thinking and memory. These assessments are quick, simple, and designed to identify subtle signs of cognitive decline before significant problems develop. They help decide if someone needs more detailed testing or specialist care. One of the most common tools is the mini-cog. It takes about 3 minutes and involves a short memory test where you try to remember 3 words. Then, you draw a clock showing a specific time. This test checks both memory and how well you can plan and organize. Because it's so quick and easy, it's often used in primary care clinics or community health settings to screen for early signs of impairment. Another widely used test is the Montreal Cognitive Assessment, or MoCA. It's a bit longer, taking around 10 minutes, but it's very sensitive to early changes. It looks at many areas like memory, attention, language, and problem solving. This makes it especially good at catching mild cognitive problems that other tests might miss. Because of its thoroughness, it's often recommended when doctors suspect early dementia but need more detailed information. The General Practitioner Assessment of Cognition, or GP-COG, is designed specifically for busy primary care visits. It takes less than 5 minutes and combines a quick test of the patient's thinking skills with questions for someone close to the patient, like a family member. This helps gather more complete information about how the person is functioning in daily life, which is important for early detection. There's also the Self-Administered Gerocognitive Exam, or SAGE. This is a questionnaire people can do themselves. It includes questions that are a bit more challenging, helping to spot very mild memory or thinking issues. Studies show it has good accuracy and doesn't often give false alarms, making it a helpful tool for early screening. The Memory Impairment Screen focuses mainly on memory recall. It's quick and simple, often used in primary care to identify people who might need more detailed testing. Sometimes, doctors also use informant-based tools, like the 8-item informant interview or the short informant questionnaire. These gather observations from family members or close friends about changes in memory or behavior, which can be very helpful in catching early signs that the person might not notice themselves. It's important to remember that the widely known mini mental state examination is less ideal for very early detection because it can be influenced by a person's education or cultural background. No single test can definitively diagnose early dementia. Instead, these assessments serve as initial screens to identify who might need further evaluation by specialists. Early detection is valuable because it opens the door for timely diagnosis, planning, and management. It can help improve quality of life and ensure that support and resources are available sooner. In clinical settings, these tests are often part of routine checkups for older adults or those at risk. If a screening suggests possible impairment, a healthcare professional will usually recommend more comprehensive neuropsychological testing to confirm the diagnosis. Always remember, if you or someone you care about shows signs of memory or thinking problems, consulting a healthcare provider is the best step to take.